Humans have used extreme heat to trigger healing and social connection for thousands of years. This reliance is visible in the structured architecture of Roman bathhouses, which served as the first formal spas for entire city populations. As these instincts evolved, they adapted into distinct cultural practices, such as the wood-fired Russian banya. These environments utilized intense heat to induce physiological change. In modern wellness spaces, we still seek out these environments, the wood-lined sauna and the tile-lined steam room, but we have largely lost the contextual understanding of how they function. Most people step into whichever room is available, assuming that sweating is just sweating, and the temperature is the only variable that matters. Treating saunas and steam rooms interchangeably is a physiological mistake. Dry heat and moist heat trigger completely divergent biological survival mechanisms. This chart establishing the sauna environment shows its defining metric, extreme heat. Temperatures here typically peak between 150 and 195 degrees Fahrenheit. To make this extreme heat survivable, the moisture must be removed, keeping humidity between 10 and 20%. The steam room side shows different parameters. Here, the temperature is significantly lower, hovering between 110 and 120 degrees Fahrenheit. The defining factor is moisture density. Humidity shoots to 100%, creating a thick, wet, saturated cloud. This contrast, 180-degree dry air versus 115-degree wet air, forces the human body to deploy two completely different physiological recovery protocols to survive the environment. In the extreme dry heat of a sauna, your body mounts an immediate defensive reaction, rapidly elevating your core temperature to match the room. This triggers a cardiovascular response. To cool the core, your heart must pump significantly harder to push blood towards the skin surface. This accelerated, pressurized blood flow delivers high levels of oxygen to the tissues, which induces deep muscle relaxation and aids in cellular repair. Because the environment is so dry, your body attempts to cool itself through rapid, heavy sweating. This acts as a systemic flush, helping the body purge the lactic acid and toxins that build up during intense physical exertion. However, there is a biological trade-off. This environment demands a high baseline of physical tolerance and causes significant moisture loss from the skin and mucous membranes. The sauna is essentially a passive cardiovascular workout and a deep tissue recovery tool, but it requires aggressive rehydration to compensate for the loss. The steam room provides a different biological trigger, the continuous inhalation of 100% water vapor. This moist heat directly targets the respiratory system, opening airways and relieving sinus pressure. On the skin's surface, the vapor opens pores and prevents transepidermal water loss, stopping internal water from evaporating into the air. But the steam room has a hidden physiological stressor. Because the air is already at absolute maximum humidity, your sweat cannot evaporate. Without evaporation, your body cannot cool itself biologically. This makes the moderate 115-degree air feel much hotter and limits how long you can safely stay inside. The steam room trades deep cardiovascular stress for targeted respiratory and dermatological hydration. Despite their differences, both environments share specific biological risks that occur whenever the body is subjected to extreme heat. The most immediate risk is vasodilation, the rapid expansion of blood vessels. This causes a systemic drop in blood pressure as the body dissipates heat. In a healthy, hydrated individual, this pressure drop induces deep relaxation and can prepare the body for restful sleep. But for the elderly, for pregnant women, or those with cardiovascular issues, this rapid pressure drop creates a severe fainting risk. Whether dry or moist, heat therapy is a powerful biological stressor that requires you to listen to your body's limits. Choosing between these two environments should be based on your immediate physical symptoms rather than personal preference. This decision tree shows how to map those symptoms, starting with the athletic optimizer. If the symptoms are heavy muscle fatigue and lactic acid buildup, the path for cardio and muscle recovery leads directly to the sauna. The second archetype is the relief seeker. For those dealing with seasonal allergies, sinus congestion, or dry skin, the respiratory path leads to the steam room. For general stress relief, the tree suggests an alternating use approach. Matching the thermal environment to your specific physical symptoms ensures the heat exposure is aligned with your body's internal recovery goals. Optimizing these therapies doesn't require choosing one room forever. You can use circumstantial alternation: the steam room in winter to combat dry air and sinus pressure, and the sauna in summer for intense recovery. Regardless of the room, follow the safety protocols. Keep sessions under 15 minutes and hydrate before and after. Rather than sweating blindly, letting biology dictate your environment ensures your heat exposure is purposeful and grounded in your actual needs.